Good morning, my dear students. Today I am going to narrate something about how to write forensic medicine practical record. In this video, I want to emphasize on post-mortem examination report. Post-mortem examination report, PME report, which contains three subheadings. One is preamble, observation, and opinion. Three. In preamble, we are mentioning two numbers. One is our number, next one is the FIR number. Our number means PME number, that is 23 bar 2024. In the year of 2024, that is the 23rd case. Same FIR number is carried 184 bar 2024. So in the year of 2024, 184th number case. And in preamble, we are mentioning about requisition received from whom, that is station house officer, any police officer, or any inspector in case of murder case, in case of dowry death or exhumation or police firing or custodial deaths. We have to receive from requisition from executive magistrate. Then we have to write requisition received from executive magistrate of Tirverkadu Tahsildar, Tahsil area, or revenue divisional officer, RDO, or inspector of police. Like that we have to mention about accordingly. Then body brought by, accompanied by, what is the name of the constable, what is the number of the constable, and belongs to which police station. Then what is the number or section they registered the case, 304A in case of road traffic accidents, 304A IPC. So now recently police also following Bharatiya Nyaya Samhita sections, BNS sections. Okay. Next, details of the patient. If the known patient, make a name, his name, age, sex, address, marks of identification. Consent is not necessary. Consent already where it is implied. In medico-legal cases, consent of the relatives is not necessary. Already requisition of the police is itself as a consent. These the things we are mentioning in preamble. Next, going for observation. In observation, again, three parts: external appearance, antemortem external wounds, and antemortem internal wounds. These are the three subheadings again in observations. In observations, external appearance. External appearance, we are mentioning about the build and nourishment of the body, condition of the body, condition of the cloth, condition of putrefaction, stage of putrefaction. These are the things. Any additional stains, any additional material or foreign material, either belonging to victim or foreign material. We are mentioning clearly what is the appearance of body. External appearance. For example, body is preserved in cold storage. Usually hospital death cases, body is preserved in cold storage after death. So body is not showing any signs of putrefaction. Body is fresh. Deceased is moderately built and moderately nourished. Built is related to the skeletal build, and nourishment is related to the muscles and fat. Based on that, we are describing. Next, body is showing some signs of putrefaction. In case of spot death cases, where the body is recovered 12 to 24 hours after death, in such case, because of lack of preservation, body is showing some signs of putrefaction. Putrefaction signs are blips, slippage of epidermis, post-mortem purge fluid oozing from the nose, nostrils. Such things we have to mention, whatever the color change. Then again, what are the post-mortem changes is present over the body. Distribution of hypostasis, color of hypostasis. For example, bluish purple hypostasis present over back of the body and hypostasis is fixed. At the same time, we have to mention about rigor mortis. Rigor mortis present in all the muscles of the body except finger muscles, like that. Next, any additional stains. For example, in railway accident cases, a triad of stains: grease, mud, and blood. This triad of stains is present over the body. Comment on what are the clothes and what is the condition of the cloth. For example, clothes are intact, or clothes are torn, or clothes are showing clear cuts in certain areas. You mentioned that certain areas. Everything should be quantitative. My suggestion is no reporter should mention as very huge cut, very small cut, qualitative description is not much significant scientifically. Please go for how big it is, how many centimeters, how many inches, preferably centimeters. So quantitative description is always better. Coming to the observation, external appearance. In this external appearance itself, you have to comment on post-mortem artifacts. For example, ant bite marks of 10 into 5 centimeters area over front of the chest or side part of the chest on right side, like that. Any animal gnawing marks, post-mortem animal gnawing marks. For example, body is found in forest, body is recovered after only 12 hours. In the gap of 12 hours, some jackals or any wildlife may attack the dead body. So it is creating post-mortem animal gnawing marks. They are pale in color, not showing any blood clots, no vital reactions. Based on that, you have to identify these animal gnawing marks you mention in external appearance. For example, in a hanging case, I have seen a case. The relations of the deceased, they don't want to make a medical legal case. Before arrival of the police, they applied turmeric all over the face, including neck. During post-mortem examination, after removal of turmeric paste over the face and neck, we found abrasion mark on the neck. In such case, in external appearance itself, we have to mention a thick paste of yellow colored turmeric paste is applied over the face and neck. After wash, we have found a ligature mark underneath the coating of yellow paste. So this is the way of description. There is no limit in sensational and very prominent cases. We have to write very descriptive manner. Don't hesitate to write elaborately. The cross-examination in court of law may run days together. So any reporter of post-mortem examination, after submitting his report to the court of law, the court will send a summons to the examiner, may subject it for cross-examination, especially in murder cases. Next, antemortem external wounds. Antemortem external wounds usually seen in road traffic accidents. In road traffic accidents, usually there may be contusions, lacerations, and abrasions. These are the common wounds in road traffic accidents. Whereas in assaults, incised wounds, contusions, even chop wounds are common in assault cases. Usually, any pedestrian is involved in road traffic accidents without abrasions, very rare. Road traffic accidents is very rare. Motor cyclist fracture is common in bicycle riders. Next, any assault case. In assault case, chop wounds are common over above the level of hat line. In assault case, either contusions or lacerations of the vault, scalp vault, and fractures above the line of hat line is very common. Based on this, we can volunteering our statement, the possibility of homicide cannot be ruled out. Either directly saying it is a homicide or suicide, we can say that the possibility of homicide cannot be ruled out. That is volunteering statement can be done in opinion part. That is third part. Now I am talking about observation part. Antemortem external wounds. Better go for name the wound, size the wound. Better for either 2 dimensions or 3 dimensions, better in centimeters. For example, 10 centimeters into 5 centimeters into 2 centimeters. Last 2 centimeters is depth of the wound. For example, in abrasion and laceration, actually there is no need of the third dimension. For lacerations, incised wounds, chop wounds, the third dimension, especially in centimeters, is must. You can describe as bone deep or muscle deep or but you should not write like very deep wound, very big wound, very small wound, or very minute wound. Such words you should please avoid. How far minute? Mention it as in mm or centimeters. That is my suggestion. Next, this is about injuries. Injuries are common in road traffic accidents, assaults case, even in electrocution also. There may be some kind of injuries, that is jowl burn, entry wound or contact wound. Next, crocodile flash burns. In case of loose contact, high voltage, electricity, you will get crocodile flash burns. Filigree burns are seen in thunderstorm. These are some very characteristic wounds. 2 fang marks, they are puncture wounds with inflammation surrounding is seen in snake bite. There may not be any injuries in case of electrocution, especially the body is wet. There may not be any injuries in scorpion sting. There may not be any injuries in case of poisoning. In case of a natural death in custody. For example, patient died because of cardiomyopathy or acute bronchial asthma in the central jail. In such case, body is subjected for medico-legal autopsy. In such case, there may not be any external injuries found over the body. You have to write like this. Internally, usually internally any organs are subjected for injuries, lacerations, contusions, even contricoup injuries. All this you have to mention accordingly. Next, in case of poisoning, viscera is showing congestion in cut section, whereas hemorrhagic shock, after receiving the injuries, patient survived 2 to 3 hours or considerable time to lose blood. In such case, patient is dying due to hemorrhagic shock. In such case, internal organs are pale in cut section. Comment on stomach contents. Stomach is partially filled with partially digested food material without any specific smell. Comment on condition of the mucosa. Mucosa of the stomach. Stomach mucosa is normal, not specific features. In case of poisoning, stomach mucosa is congested. Stomach contents are getting kerosene odor or pungent smell in case of organophosphate poisons. In case of phosphorus, garlicky odor or some other material, you have to mention about granules of pesticides with pungent smell or kerosene smell. Most of the organophosphates are kerosene is the solvent. Based on that, you have to mention about internal observations. Next, one more thing, in case of asphyxial deaths, that is hanging, internal organs are congested. You have to observe cyanosis of the nail beds, cyanosis of the lips, cyanosis of the tip of the nose. These things you have to mention in external appearance. Any petechial hemorrhages of the lung, you have to mention in internal observations. Congestion of the viscera, you have to mention in internal observations. Antemortem internal wounds. That is the next one. Coming to these are the observations. Based on observations, we are deriving some conclusions. These conclusions are mentioned in opinion part. Opinion is given on what is the cause of death, what is the time of death. Cause of death usually due to hemorrhagic shock due to multiple wounds. Deceased died as a result of hemorrhagic shock as a result of multiple wounds. For example, in another case, a deceased is died in the spot immediately after receiving a blow over the abdomen. A severe blow over the abdomen or any sensitive area like scrotal area or temporal area, patient may go into neurogenic shock immediately, or any blow over the neck where the vagus nerve is stimulated. Vagus nerve will extracranial course which pass through the neck and chest and up to abdomen. Any time if the vagus nerve is stimulated, then it is prone for cardiac arrest. In such a case, you have to mention about patient died as a result of neurogenic shock, as a result of acute trauma or acute blunt force. Like that, you can give a opinion. In case of asphyxial death, hanging, patient died as a result of pressure over the neck. Most of the time, the possibility of suicidal hanging cannot be ruled out. Like that. In case of strangulation, you can mention the cause of death. Patient died as a result of pressure over the neck as a result of homicidal strangulation cannot be ruled out. Sometimes a clear-cut case of suicidal strangulation may be seen, where there is a ligature material is tied himself with a lever or circumstantial evidences showing that it is self-harm. In such case, suicidal strangulation is also possible. These are our volunteering statement, cause of death. In case of poisoning, after receiving the chemical examiner's report from forensic science department, you can mention patient died as a complication of so and so poisoning, organophosphate poisoning, rat kill poison, or phosphorus poisoning, or heavy metal lead poisoning, or arsenic poisoning, like that. What is the poison is detected in forensic science laboratory report. Based on that, we can coming in conclusion of, until then we can issue post-mortem report as cause of death pending, time of death. In case of hospital death, we can mention patient has died in hospital. Enough. Hospital records will give the clear picture of what is the time of point of time. In case of spot deaths, based on post-mortem changes over the body, condition of hypostasis, rigor mortis, cooling of the body, based on that, we are coming to the conclusion of time since death. That may be 12 to 24 hours, or 24 to 48 hours, or 48 to 72 hours, or 1 to 2 weeks, or in advanced decomposition state, few months. Based like this, we can give the time of death. This is brief about how to write post-mortem examination report. In case of hanging, asphyxial deaths, you please mention the ligature mark as abrasion. A brown colored abrasion of 2 centimeters around the neck with a gap of 10 centimeters below right ear. The abrasion mark is situated 2 centimeters below to symphysis menti, 5 centimeters below to right mandibular angle, 2 centimeters below to left mandibular angle, 10 centimeters below the occipital protuberance. In case of strangulation, you have to describe the ligature mark as 3 centimeters abrasion encircling the neck without any gap. Ligature mark is horizontal in nature. At the base of the ligature mark, there is a pattern of a rope, spirals of 2 mm in width. So, like this you can have. If necessary, you can attach some digital documents like photographs taken during the post-mortem examination report. These are the videos, these are the photographs taken during post-mortem examination. Usually, in case of custodial deaths or any magisterial request, in such case, post-mortem examination can be digitally recorded. In such case, a copy of video clippings can be attached along with post-mortem examination reports. Usually in the second time we are conducting post-mortem examination on same body in sensational cases. In such case, usually digital videography is mandatory. Sometimes a team of doctors are conducting medico-legal autopsy. Usually any custodial death, if the case is subjected for medical disease, a professor of general medicine, professor of forensic medicine, and any other team member can be joining in the custodial death case. In such case, videography can be taken. The clippings of videography and photography can be attached along with post-mortem examination report. Whenever the court asking for oral testimony, if necessary, the leader of the team or whole team can attend the case to the court for oral testimony and facing cross-examination. This is the procedure of how to write post-mortem examination report. Various scenarios, either injuries or accidental, homicidal, suicidal, and poisoning cases. In self-harm also, the scenario, we have to mention about the condition of the clothes. For example, self-harm, cutthroat injury. Cutthroat injury, usually the deceased is sitting in front of the mirror. Usually clothes are not torn. Injuries are over the accessible area. Hesitation cuts over the beginning of the injuries. Then deep wounds are only one or two, not more than that. Self-harm will be possible, suicidal, cutthroat injuries, circumstantial evidences, and number of the wounds and depth of the wounds, accessible area of the wounds, then hesitation cuts. These are the things. Based on these things, we can discriminate, is it a self-harm or homicidal in nature. Based on these points, every medical student has to develop some creativity and narration capacity to describe the wounds in systematic manner, scientifically, and we have to mention about the healing process of the wounds. Is it clots or healing wound, or what are vital reactions, and then what is the edges of the wounds and any specific features. Based on that, we can come to the conclusion. So we should not forget the three parts of the report, that is preamble, observation, and opinion. In again observations, there are 3 points: external appearance, antemortem external wounds, and antemortem internal wounds. In opinion, we have to mention 3 points: what is cause of death, time of death, and voluntary statement based on observations, suicidal, homicidal, accidental. Manner of death also you can comment, but it is not must for all the reports. Based on these guidelines, please go through the various scenarios and start writing forensic medicine practical record. Thank you, my dear students.